Hi, Tamika. This is Jennifer, and I am responding to your discussion post. In response to your post, in diagnosing and treating clients with a possible addictive disorder, it's appropriate to decipher if there's even something to treat. A person may use substances occasionally, or they may feel that their substance use is not enough to consider an addiction. And this is when it's important to administer an assessment that can determine if a substance use disorder is present or if their addiction is affecting their life in a major way. Obtaining historical information on a person's behavior patterns, obtaining family history, considering that genetics and history of alcohol problems in the family can be a contributing factor in developing alcohol use disorder, according to the National Institute on Alcohol Abuse and Alcoholism. And also obtaining a mental and physical medical history is essential in developing a treatment plan if an addictive disorder is determined to be the diagnosis. In reading your discussion posts, you cited the article Performance of a Brief Assessment Tool for Identifying Substance Use Disorders. And this article discussed the three phases of the decision model that's helpful in determining the needs of clients with addictive disorders. The three phases are screening, comprehensive assessment, and treatment planning. And in regards to screening, this is the first step. And this is when the triage assessment for addictive disorders, the assessment that you chose, this is when it demonstrates that it's one of the most effective screening tools and that it is extensive, it's an extensive diagnostic tool for diagnosing substance use disorders according to the DSM guidelines, which I'm citing Campbell et al. In my further research of the triage assessment for addictive disorders, Murphy and Newman stated that it's based off the DSM criteria for substance abuse and dependence. However, when compared with the substance use disorders diagnostic schedule, the SUDS 4, it does not provide questions to cover all of the content of the DSM as thoroughly because the triage assessment for addictive disorders is a tool intended to be used for rapid assessment. But I feel that because it's only 31 questions and it typically takes 10 to 15 minutes to complete, that this is adequate enough for initial screening purposes. That is all I have for my response. I hope you enjoyed listening and I enjoyed reading your post.